Swallowing is truly a sensory and motor experience. In order to swallow, we have to have sensory input to trigger the motions of our swallow to get what we need to swallow down to the stomach. What I want you to do right now is swallow 5 times in a row. And if you feel like you can keep swallowing, swallow 10 times in a row. What you'll notice is as you go along, you're going to run out of saliva and it's going to be harder and harder to trigger your swallow. And that's because we have to have that sensory input to tell our muscles that it's time to swallow. So generally we need at least 1 cc to 3 cc's, which is a very, very small amount of saliva or something to swallow in order to have those muscles trigger that response and send it down to the stomach. How this happens is the integration and coordination of the central and peripheral nervous system. So our peripheral nervous system, again, is those cranial nerves specifically for swallowing that are going to give us the sensory input that something is in our mouth, the weight of that object, how big it is, the temperature of it, and the taste of that object, and if that object is still in our mouth after we swallow. The central nervous system is going to regulate that response to how much we need to move our muscles to get that food to a safe consistency to swallow while we're chewing, and then initiate the movement of our muscles to get the bolus down to the stomach. Now, once we have that information, it's going to send that signal back through the peripheral nervous system to the muscles so that the muscles can complete their job. So in the central nervous system, we have 3 areas I really want to discuss with you for this class, but keep in mind that this is an introductory class and there are many other areas important for swallowing in the brain, but I'm just going to refer back to ones that are familiar to you now. So the motor cortex and sensory cortex, again, are those areas of the brain that hold that information for the patterns of our swallowing, but they're really only involved in the volitional or voluntary stages of swallowing, meaning that we have control over those stages of the swallowing. We can determine how long they last if we feel like they need to last a little bit longer, or if we're in a hurry while we're eating, we might chew our food really quickly. The brainstem, important for swallowing, is the medulla. It's where most of the cranial nerves for swallowing are housed, but it really controls the involuntary stages of swallowing. So these are the pharyngeal and esophageal phases. So once the contractions of the pharynx start and the esophageal contractions start, we can't do anything to stop them. I can't, in the middle of my swallow, say, oh, stop. Okay, so that's really where those commands come from. Once our body knows that it's time to swallow, that bolus has hit the back of our throat to initiate that beginning of the pharyngeal stage, our body is taking control of how long and when the airway needs to close and how long and when the pharynx and esophageal muscles need to squeeze together to get those boluses down to the stomach. Now, the cerebellum is the area responsible for sequencing and timing of the swallow, which means that it tells us the order that the muscles need to move in order to most efficiently get that food down to the stomach. So it's not going to tell the airway to close while we're still chewing things in our mouth in the front. But if we start to move that food to the back of our throat, then we might have some closure of the airway in preparation for the swallow to protect the airway. It also isn't going to tell the upper esophageal sphincter to open while we're chewing. It's going to really trigger that response in the middle of our pharyngeal swallow and that coordination to say it's time to open the esophagus, this is how long it needs to stay open, and then it's going to close the upper esophageal sphincter again once it knows that the bolus has passed through that sphincter. And it gets all that information again, that sensory information from the peripheral nervous system. So when we're talking about all the different cranial nerves, we can talk about how they are specifically involved with swallowing. So remember, the cranial nerves have sensory and motor components, and how those signals are interpreted and used is determined by the central nervous system. But it's really involved for all sorts of different things in communication, not just in swallowing. But for this lecture, we're only going to focus on their role during swallowing. So cranial nerve 5, the trigeminal nerve, you'll remember, is a mixed nerve, meaning that it sends sensory and motor signals to the areas of mucosa in the front 1/3 of the tongue. So during swallowing, it's responsible for opening and closing of the jaw for biting and chewing, and then it tells us the temperature, weight, and size of the bolus. Cranial nerve 7, the facial nerve, gives us mixed signals as well for the lips and cheeks, and then the front 2/3 of the tongue. So it's going to give us the taste in the front 2/3 of the tongue, and it also helps keep the food in the mouth with the closure of the lip muscles, or the orbicularis oris, which is that circular muscle around the area of the lips. It's also helpful for the squeeze of our cheeks. Say we have something stuck in the corner of our mouth between our gum line and our cheeks, it'll tell us that something is there and kind of squeeze our cheek muscle to get it out of that area. Cranial nerve 9, the glossopharyngeal nerve, is going to give us mixed signals for the pharyngeal constrictor muscles. So those muscles that squeeze them together in the pharynx to get the food out of the throat. And it gives us the afferent signals for the tongue, the pharynx, and the velum. So it's going to help with the timing of the triggering for the pharyngeal swallow. So it tells us when that bolus has reached the back of the mouth and it's time to start squeezing those muscles to get it out of the throat. And it also tells us what our food tastes like in the back 1/3 of the tongue. So you'll see that the facial and glossopharyngeal nerve work together. And then it helps squeeze the muscles of the oropharynx together to get it out, the bolus out of the throat. Then we have cranial nerve 10, the vagus nerve. And remember, this is the wandering nerve, so it really has a lot of roles. But for swallowing specifically, it's a mixed nerve. So it's going to tell us if there's any kind of airway compromise across the larynx. So if anything has touched the epiglottis, if it's touched the false vocal folds, or if it's touched the true vocal folds, or the bottom part of the pharynx. So that's the hypopharyngeal area. So this is what will tell us that if something has entered the first 2 layers of protection of the airway, if we need to clear our throat, or if it feels like something's bigger than that, it'll tell us if we need to cough. And then if we have something stuck in our throat after we swallow, this nerve will tell us that. Then we also have airway protection. So it tells the vocal folds to close when it's given the signal from the cerebellum, and then it also helps with the propulsion of the bolus from the pharynx, so working with the glossopharyngeal nerve. Cranial nerve 12, the hypoglossal, is a motor-only nerve, and it gives motor signals to the tongue and the pharynx. So it's helpful for positioning the food for chewing. So it's what's going to help move the food onto the chewing surface of the teeth, and working with cranial nerve 5 as the jaw opens and closes. So if you might bite your tongue while you're chewing, it's a mix-up of signals between cranial nerve 5 and cranial nerve 12. And then this nerve also helps with moving the food back towards the oropharynx. So again, it's working with cranial nerve 9, where we've moved the food to the back, and then cranial nerve senses that and triggers that pharyngeal swallow.